We're talking TB next here on the show. On my banner, when I heard that the cases are increasing, they are going up, I thought we should spend time on this particular subject on the AM show. So we're talking about TB with Dr. Hansen Norte, who's Deputy Program Manager with the National TB Control Program. Good morning to you, sir. Thanks for coming.
Good morning, Mama V. How are you?
Very well, thank you. Yourself?
I'm doing great.
Let's start with the very basics. What is TB?
Good. TB is a bacterial disease that affects largely the lungs. It takes a liking for the lungs because of the way it lives its lifestyle. So the bacteria likes areas where there's a lot of air. And so the lung is the best place it wants to live and survive, and it does very well in the lung. However, because it's also spread through the bloodstream, it could end up in various parts of the body. So you can have TB affecting the brain, you can actually have TB affecting the bones, you can have TB affecting the intestines, you can have TB affecting the kidneys, and any other parts of the body. You can even have TB affecting the skin. So TB generally affects every part of the human body.
So for us in Ghana, with the cases that you've seen and heard, where does it most affect?
Most of our cases are lung cases.
Okay.
The bulk of our cases are lung cases. And with the existence of HIV, we also tend to get quite a substantial number of cases that present outside of the lung. We call that extrapulmonary tuberculosis.
Okay. How does tuberculosis exhibit itself? I mean, how can you tell if you're beginning to develop?
Most people would exhibit a cough, or they would present to a hospital with a cough. But generally, if you look at the way the disease process goes, the cough is actually end of the road for the disease process. So by the time you are exhibiting a cough, it means the disease is actually very well established within your body, and it's causing the destruction. A number of people would also see signs of weight loss, unintentional weight loss. They would have night sweats, that is to say that at night they sleep and they wake up in the middle of the night very wet with sweat. There's loss of appetite. There's a generalized fever, feeling of unwellness. Usually the fever is not a high-grade fever, it's a low-grade fever. And general weakness.
Okay.
The way associated with the cough, there's a lot of sputum production. Sputum is phlegm production within the lungs, and then there's chest pain. And then ultimately, some people also have blood within the phlegm that they produce. So these are the general things that we see. You would have a mix of these things. You wouldn't see one person just exhibiting one feature of the disease.
Is it like a fever that develops into this situation later on, or you can just come down with it?
Okay. Most people would have a gradual development of symptoms. So it takes a real long time, and a lot of people do not take these things seriously. Because of that, people literally ignore the symptoms associated with the disease. You cough a day or two, or they feel some irritation in their throat, they chew some ginger, they think they are fine, and life goes on. So there's very little attention paid to the symptoms because it's more of a chronic disease, slowly developing disease process. And so there's very little that it won't drastically knock you out.
Okay. Okay, but if you reported to the hospital, would they immediately know that this is what you're suffering from?
Usually, among health workers, TB tends to be a diagnosis of exclusion. That is to say that they would have looked at everything, they think they don't find it, and then that's the last thing they would want to look at. But for us in the National TB Control Program, we want to bring TB to the attention of health workers, to begin to think about TB as a primary disease to be investigated. Because after all, the national program provides resources for testing, and so there's no cost to the patient. So if you can investigate tuberculosis and move that from the way, then you are free to do all your other investigations to find out whether the person is suffering from other disease conditions.
You know how malaria has become, like a common one when you see a doctor and you start mentioning the signs.
Yes.
Then they ask, when was the last time you took an anti-malaria?
Good. We wish clinicians would be that savvy when it comes to talking about TB, and they would want to every day ask every client who walks into their facility about tuberculosis. Unfortunately, maybe because I'm handsome looking and I don't look like somebody who's so ill. Yeah. So the clinician. I
think your signs are a lot more sophisticated.
No, the clinicians will feel reluctant to ask about the disease, but we want clinicians and health workers to think about TB as a primary disease that gives problems. So they should want to ask about it as often as possible. Because of that, we have put in place this new system where we are in OPDs. We are actively screening, asking people who walk into health facilities to seek health care, irrespective of the type of disease condition they come with. We are asking them about symptoms of TB. Are you coughing? How long have you been coughing? Do you have chest pain? Are you producing a lot of phlegm? Is there blood in it? These are things that indicate that there's a possibility you may be having a chest problem or TB for that matter, and so we would go ahead and investigate you for tuberculosis.
The normal blood test that we do, is there provision for tuberculosis, or once they see maybe your white blood cells or something, there's some indication of a bacterial infection that can lead to them discovering that you've got TB?
The best test for TB is the sputum test, where phlegm from the patient is produced, and then it is directly tested. So it is processed, and then with a microscope you look at it to visualize the bacteria causing the disease.
Oh, okay.
It's quite a cumbersome process, and it doesn't yield as much because of the nature. We are using a microscope. The sensitivity is not too high. For most people, you would miss 1 in every 2 cases. So the national program is looking at using newer technologies and newer strategies to help us diagnose more TB patients. We are introducing what is called the Gene Expert technology, which is actually molecular testing. So even with a little little sputum sample, we will test and look for the bacterial DNA. Any presence of bacterial DNA means the person has the bacteria within their lungs.
Okay.
And so that is a diagnosis. In addition to that, we're also introducing the chest X-ray screening program, where we would want to screen as many people as possible, because like I said, cough is actually an end stage, but when the disease process begins within the lung, you will see changes if you took a chest X-ray. To the untrained eye, the chest X-ray will still look fine, but to the specialist or somebody who understands that, they will see signs of early disease.
But these are things that we are yet to do.
We actually have started some of these things. With the support of our partners, with the support of government. We have actually started some of these things in 90 districts around the country. And this year, we're actually scaling up to all the 216 districts around the country.
Okay.
Putting in place all these technologies in order to be able to find more TB cases within our borders.
Okay, let's talk about vaccines. And once we talk vaccines, let's talk about children.
Okay.
How prevalent is TB in children?
TB in children is actually missed in a lot of situations. But when it comes to vaccination, the only vaccine available is the BCG vaccine. The BCG vaccine, fortunately, protects children only during the early stages of life, up to 5 years. So a vaccine, BCG given at birth.
Yeah, I think they give you within a week.
Yes.
Yeah.
Protects the child from very severe forms of TB at that age. And the maximum coverage is about 5 years. After that, there is no vaccination and there is no coverage. So the more of education, practicing basic cough hygiene. I'm sure we all remember we were taught very simple things in school. When you cough, cover your mouth. Don't spit around. It looks like we have become sophisticated, so we've thrown all these things away. We are not practicing these very, very simple, but these are very simple and effective means of preventing TB transmission.
Is the education around the schools? Because, you know, when you have a baby, you go through the booklets they give you for the immunization. You see the BCG.
Yes.
I think is one of the early vaccines that you take.
Exactly.
But there's no education that says after 5 years, because I have not gone through the process. After 5 years, this is what you have to do, or, you know, that kind of thing.
These are public health things, and so we usually do a lot of education within schools. We do a lot of education within health facilities for the effectiveness of the vaccine. It is being used for the period when it is most effective. That is during the early stages of life, and that is where it's supposed to be. The rest of it has to do with our public health interventions and our public health educational activities, which are going around.
Yeah, because, you know, as a parent, you know, your child plays with other children. Sometimes they drink from the same bottle. Exactly. You may never know. And then they cough. They may cough on each other. And
the good news is that in a lot of children, TB is hardly transmitted from one child to another.
Oh, thank God. Okay.
A child,
but that's hardly. So there's a possibility.
There's a possibility. And a child who has TB is very likely to have gotten it from an adult, not from another child.
Oh, okay.
In medicine, we don't say never.
Yeah, never say never.
Exactly. But a child who has TB is very likely to have gotten it from an adult. And so when we find a child who has TB, we actually look out for adults they are living with and screen them, because they are likely to be the source of the disease.
Okay. We're getting messages on 0560 800,000. Obednijan sent me an earlier message when I was chatting with representatives from SOS Children's Villages. Said, Aiko, in fact, when I become rich, I'll support you financially. You don't have to become so rich in order to do this. You can start right now. But the question related to this particular conversation, Obednijan says, Mama V, please ask him, how long can a person live with tuberculosis?
That's a very interesting one. A lot of people have the disease process ongoing in their body, but because their immune system is good, they do not exhibit frank symptoms of the disease, and so they don't come down very ill with the disease. It is very interesting for us. We did a survey in 2013. And one of the startling things we found was that there are a lot of normal-looking Ghanaians going around their duties who do not show any symptom, and yet we were able to culture TB bacteria from their sputum. We got them to produce sputum, and we tested it, and we were amazed to find that there are a lot of people with no symptoms who have the bacteria.
How dangerous is that?
So these are people who would cough around. They live their lives normally.
It could be me. I mean, the description you just given.
Yeah. And these people actually literally transmit the disease around without necessarily showing any sign of any symptoms. These are the people we actually want to find. And that is why we are putting in place the newer technologies that are more sensitive. I talked about the chest X-ray screening program, because that would actually see early signs of disease within the lung, which and even if they produce sputum and you use the regular testing methods, you will not see the bacteria because you are trying to visualize the bacteria. So with people like that, you can use the molecular tests to actually confirm the presence of bacteria. And you can go ahead and grow the bacteria in their lungs.
But what's the risk if I have the symptoms in me and yet I'm not exhibiting it?
Because you may not necessarily realize you're carrying bacteria, you tend to do all the bad things. Cough without covering your mouth, sneeze all around, spit all around, and you would be actually releasing bacteria to unsuspecting people around you. That is why the educational component is very important. cover your cough. Very simple, yet very, very effective. Use a handkerchief. If you feel like spitting, put it in a handkerchief or tissue, put it in your pocket. Change your handkerchief every day. If you put it in tissue, discard it appropriately.
How about yawning?
No, yawning.
Okay.
And you know, it's also interesting that we have a lot of people who just sneeze, spit around, all these things. All these are means of spreading the disease.
Okay.
If you don't have a handkerchief, one of the very effective things you can do is to sneeze or cough into the inner part of your palm. So you cover your mouth like this.
Oh, okay.
It's very effective.
But you're not releasing anything there that can survive? And
no.
Okay.
And even if you put something there, it's likely to drop off. It wouldn't infect anybody.
Do we have things in our body that fights the bacteria?
Medically, we call it the immune system. Everybody has heard the term immune system. Immune system. What is the immune system? It's more of a defense mechanism. So it's, we say like the army within your body that fights against disease. And if you are living healthy, you're doing very well, this army is very strong. That is to say, you are supporting your army effectively. And so your army looks out for bacteria, invaders, and then fights against them. Anytime TB bacteria enters your body, the army goes out, arrests the bacteria, and then quarantines the bacteria. So with time, people who have been exposed to TB bacteria, if their immune system breaks down, as in say maybe they get HIV disease or they get cancers, and the immune system breaks down, or even in old age, if they are not being well taken care of, the bacteria breaks out because it is able to then overcome the immune system, and then it spreads out in the body and causes disease. It's also one observation we have that there are a lot of older people who tend to report more tuberculosis.
Okay, so what are we not doing right in the sense that the cases are now going up? What are the figures exactly?
Okay, in terms of what we are not doing right, I think I've gone over and over the simple things.
We've abandoned the simple things that we used to do.
Things. And so we need to go back to the simple things. With regards to the numbers, the national survey we did told us that we have a case burden of about 290 cases out of every 100,000 Ghanaians. So we took time to examine about 264,000 Ghanaians around the whole country. And we observed that if you did the analysis, it came up to the 290 cases of TB out of every 100,000 Ghanaians.
Okay.
That translates to a little over 77,000. With more, that was in 2013. Currently, our estimate says that we have about 282 out of every 100,000 Ghanaians, which translates to about 76,000 cases.
Out of the total population?
Yes, out of the total population. It's also interesting to know that because there is active transmission going on, new cases are being developing every year. Because we estimate that there are about 44,000 new cases that come up every year. And also about 9,700 die off because they don't get treated every year. So if we don't work hard to reduce or to find more cases, treat them and make sure they get cured, what we are doing is that we are increasing the number of people with disease within the country. And so transmission gets worse with time.
Okay.
That is why it is important that as we go towards commemorating World Tuberculosis Day next week, we create awareness. We get people to appreciate the value of doing the very simple things, and also to get into health facilities and be screened. We have a system that encourages people to walk into our facilities and get tested for TB without necessarily even a doctor's request.
Okay.
And if you walk into a facility, you see the nurses at the OPD and tell them that, I think I have some of these symptoms. I would want to have a TB test.
Oh, so this is available. You can.
It is available.
I can go to Rich Hospital this morning and
any
just tell them
government
that.
facility and some private facilities that work with us. Yeah.
Okay.
We are trying to
and that's free.
It's free. You don't pay anything for it. We are trying to get as many private facilities on board because we also believe that the private sector has a big role to play in helping us address the problem of TB in Ghana.
Okay. Christian from Wamfi is asking, please, can it be cured?
TB is curable. It is actually one of the easily curable diseases. It only takes 6 months to swallow medicines. A tall order though.
6 months is only.
Yes, it's a tall order though. But what we do is to get the the patient's relative, or somebody in their community to support them, to give them a lot of attention. Medical terms, we say tender loving care, TLC, to support them during this period when they are taking their medicines, so that they would effectively take their medicines, adhere to treatment, and not miss doses. Usually, missing doses is a big problem because people have to take medicines for a long time. So once they are taking the medicines and they are not missing doses, they are very likely to get
Is it a lot of tablets?
No.
Okay.
The maximum number of tablets you can take are 4 tablets in a day. Most people will take 3 tablets or 2 tablets because dosing is based on the weight.
Okay.
And these are nice looking small tablets. So people don't have to be scared of the tablets.
Okay, sure. This one says, Aiko, I'm following your program from Dambai, but then do you have TB cases handling desk at all districts? That's coming from LMLC Michael in Dambai.
Okay. We train health workers around the whole country. So, and we have put in place this new strategy where if you walked into a health facility, maybe you came to see the doctor for maybe your menstrual pains or for your headache, at the OPD desk where they do the blood, they check your blood pressure, what you call triaging, they would also ask you about TB. So these are frontline staff. They're going to ask you, anybody who walks into a health facility, about whether they have any symptoms related to tuberculosis, whether you are coughing, any night sweats, chest pain. And with these, once they find out you have 1 or 2 of these symptoms, they would request you to do a sputum test.
Okay.
Well, they won't take you out of the queue. I mean, you wouldn't miss your place in the queue, so you just go.
Because it's not an emergency necessarily.
Yes.
How long does the test take?
The test actually just takes about 3 hours to do. The standard test takes about 3 hours to do.
Okay.
Usually, what the labs do is to batch the samples, but we encourage them to do the tests as often as the samples come along. With the newer technologies, with the gene expert technology, we're able to confirm or do a test in less than 2 hours to confirm tuberculosis.
Okay. When you're cured of the disease, can you get it again?
Yes. Like any disease that persists, if you get cured and you go back to doing all the bad things, or you get exposed to somebody who has a disease, you can actually get the disease again. It's more likely to be a new infection rather than an old infection that has been cured coming back.
Okay.
Unless you didn't take the medicines properly, then you could end up as a drug-resistant TB case.
Okay. So finally, let's talk about resources. As a program, do you have enough for all these beautiful things that you've outlined that you want to carry out?
In public, I would say resources are always the most important things, and money is never enough.
So you all live a twist.
Yes, we all live a twist. We're asking for more. In all these things that we are doing, government supports us. We also have our donor partners supporting us. We have the Global Fund supporting us. But we are actually asking for more support from agencies, donor agencies. We want even government to do more to support the our activities. In addition, we want to call upon individuals, private sector, corporate Ghana, to think about supporting tuberculosis. If 2 or 3, if one person in say Joy FM gets TB disease, because of your nice environment, they may end up transmitting to everybody. And you may lose work hours because 2 or 3 more people come down with tuberculosis. Once the disease is there, that economic loss affects the company.
All right.
So investing in TB is actually investing in economic gain for organizations.
All right. Maonyo is asking, please, which private hospitals work with you? I'm not sure if you're able to outline all the hospitals that work with you.
No, I won't be able to outline all the but I can mention a few very reputable hospitals that have been working with us. We have MAB Medical Center in the Kwashiman area. We have Megavest. We have some private hospitals in Kumasi, Bonsa Clinic. We have even some pharmacies like Dontry Clinic in Kwashiman that has worked with TB for several years. It's a pharmacy, but it's a treatment center where people go to take their medicines.
Okay.
And anybody who comes there looking for cough medicines, they actually interview them and refer them for TB diagnosis.
All right.
Sometimes the private facilities don't like us mentioning their names because they think that people, then begin to tag them as TB clinics. It's all because of the stigma associated with the disease in the country.
Yeah. But there shouldn't be any stigma, sadly. Okay, so we're wrapping up on this. GHS must improve upon their TB case search. That's another comment, and there's a final one. Mamavi, please ask the doctor whether he will talk a little about HIV, because I learned the two diseases are interwoven. He talked a little bit about it, but the concentration today is on tuberculosis. So that's where we'll leave it.
Thank you very much.
Yeah.
But I mean, it's also important to let people know that HIV predisposes people to getting tuberculosis. And so anytime we find somebody who has TB, we look out for HIV. And for people who have HIV, we also look out for TB within them.
Okay. So you have to answer my question for the day.
Okay.
What would you do differently if you became richer? I think I'm using rich, but you never know somebody's pocket, y'all. So if you became richer than you are today, what would you do differently?
I think I'll support more of more poor people.
Okay.
And I would look at supporting medical research.
Okay.
In addition to also looking at health access for people in very poor areas, poor communities.
All right. Okay. May your dream come to pass.
I'll pray hard for that.
Thank you for being here today. That's Dr. Hansen Notte, who's a Deputy Program Manager, National TB Control Program. You're watching the AM show. I've got your rich comments, which I'll be sharing with you in the bits. Coming up next is AM Talk.